Welcome in, ladies and gentlemen, to the season finale of Ocali Unreported. I'm your host, Ryan Nowozinski, and today we have a very, very, very special guest, President Designee Kayse Shrum. Dr. Shrum, thank you so much for joining us.
Thank you for having me.
What has your life been like, rather? How has it been different since you were named president?
Yeah, well, it has gotten a lot busier. That is, to say the least. It's been real exciting. You know, lots of new meetings and appointments, and trying to, I think, transition from the Center for Health Sciences and kind of wind down there, and then transition to here and start moving towards, being on campus a little bit more between now and July 1st, just to start what I kind of call my listening and learning tour. So
exactly,
yeah.
And that's the listening and learning tour. That's sort of what you're dealing with right now. And I guess that's a good place to start, where you just started, is your experience as president of OSU Center for Health Sciences. And how well do you think that will translate into being president of a university? Has President Hargis maybe, mentored you on that so far?
Yeah, I've had a couple of meetings with President Hargis, just for him to kind of tell me what's going on and what's upcoming, and talk about all the boards he's on as president and the different, things that he's doing. But as far as, my experience at the Center for Health Sciences, I do think, there are some common characteristics as, our education and research and service, kind of that land-grant mission and the way we carry that out. And we had the medical school and then graduate programs. And so a lot of those experiences, I think, do transfer. Certainly, again, kind of leading an institution that has that land-grant mission, that was really one of the most endearing things for me.
Yeah.
Not only the fact that, that's where I graduated from, and it was an opportunity to lead a college that I graduated from, but really how we would go about kind of translating everything that we did from research and education and service in a meaningful way to the greater society. And by doing that, creating a really unique learning opportunities for our students. And I think that kind of core principle translates to here as well.
I would say so. And during this time, it has been, sort of but when the time that this airs, it'll be a couple weeks since you were named president. Yeah. And it's been interesting, I'm sure. I know you said it got a lot busier, but when it comes to, your kids, you just told me off camera how your son is still adjusting to this,
yes.
Seeing your face. What has this whole experience been like,
Yeah, well, I think the day after I was announced, I guess it was on a Saturday, and I was on my way back to Tulsa, and I was standing in line, and we were in the gas station, and there were two lines, and the person who was operating this one cash register left, so there was a gentleman standing over there, and he was clearly ahead of me in line. And so when it was my turn, I said, you need to go ahead and go. He said, no. And I said, no, go ahead. He said, no, I've been watching TV. You're clearly busier than I am. So I have learned that there's not too many places that I can sneak in and out of without people recognizing me. But yeah, the kids, they've seen the Ocali on campus or whatever, and they'll text me and say, I'm not sure I can get used to this. This is weird. But they're real excited. And, we did our interview with President Hargis, and the kids were there, and my husband. And so that was a, fun experience. And, they're starting to, it's, kind of sinks into them a little bit that, they're a little more visible as well. So.
Exactly.
Yes,
yeah.
yes.
I'm sure, people will start to recognize them more, and you more, and your husband more. When it comes to people recognizing you, what are your steps maybe to get more people to recognize this university from an academic perspective?
Yeah. Well, I think, this next several, probably it's almost 10 weeks, I think, before, maybe less than that at this point, before July 1. And my plan is to really spend time on campus at the various colleges at different levels, listening to people, learning about what's going on here, And that will help kind of put together the strategy for how we do just that, elevate the visibility of Oklahoma State University, its programs, and what we're doing, and how we are carrying out our mission. And, as I was kind of talking about that whole engagement piece, about how the university as a whole is engaging with society through our research and engaging with industry in order to really just, create some additional visibility to Oklahoma State University. So that's kind of the process that I'll be in until July 1. And I'm, looking forward to going across the campus and learning so I can connect dots and really just, learn more about what are the great things we're doing, how might we do those in different ways, or how might we connect some of the great things that we're doing across the system in order to, enhance the educational experience and promote our research in a different way.
So the vibe that I'm getting is that you plan to be somebody who is leading by getting to know each school and really the faculty and professors and students within the schools.
Yes, yes. Yeah, I really, that's something that I enjoy doing, is getting to know people and listening. And, I don't know if that comes back from my medical training. You're taught to listen and, take in information before you formulate decisions. So, that's what I'm looking forward to doing, and building those relationships and hearing really what's going on, so that really hopefully people get to know me and I get to know the greater campus community, and can help kind of create that vision and strategy for going forward into the future.
Right, and you got some new friends that are coming along with you. You've got a couple new leaders coming into OSU, I'd say all across the top. Whether you want to talk athletics, whether you want to talk academic side with the provost, you're going to have people that are also coming into their first year as in a leadership position, top leadership position at OSU. First and foremost, what are your thoughts on current, or I guess future athletic director Chad Weiberg, and in what ways do you think you can, I guess, figure it out with the athletic director and the new provost, whoever it may be?
Yes. Well, so I've had the privilege of working with Chad for a period of time now. Really prior to the pandemic, we were kind of looking at how OSU medicine could be more supportive of OSU athletics and how we would engage in that way. And then, of course, the pandemic hit, and I chaired their committee to bring athletes back on campus. And so through that process, we've gotten to know one another. And so I really look forward to, learning more about his vision for OSU athletics, how we can be supportive of one another. And, the new provost, I know we have an interim provost now, and I'm looking forward to meeting her and getting to know her more. I've had just one opportunity to visit with her. It's an interesting time, because you're right. All the, leaders, the senior leadership are, retiring. And so you have this new leadership team. And I think it's going to be an exciting time to see how we bring all that together in a new way. And, you kind of look to the future and understanding the landscape of higher education and knowing that, what does a modern day land-grant university look like? And these new leaders coming in are going to be able to shape that process. Very
true, yeah. And I know that probably, a majority of students do know this, but I don't think every student knows that the Center for Health Sciences is in Tulsa.
Yes.
And, in what ways, while you were over there since 2013, have you been involved with the leadership of this campus right here? And have you had many communications with them and know a lot of people here?
Yeah. So as the dean of the College of Osteopathic Medicine, I attended all the dean's meetings. And then as I became the president, I served on the President's Council, and so I have had the opportunity to get to know people. Of course, there's a lot of people here on campus, so not as many as I would like to get to know, but throughout the years in various programs or different colleges, how we were collaborating, I've gotten to know a few people really in all the colleges. I know most of the deans. Some of them I know better. The longer they've been here, the more familiar I am with them. And so I do have some familiarity with most of the leaders across campus, but I'm looking forward to getting to know more of the faculty. Some of them I've interacted with throughout the years.
That is awesome. Yeah,
Yeah.
it's good to have a president that has experience as Burns Hargis did with many of the leaders here on campus. And sort of switching gears now. Obviously, yesterday we just saw, or rather 2 days ago, at the time of this recording, we saw the Derek Chauvin trial, and we saw just the diversity movement, not only across America but across this campus over the past year, over the past couple months. What are your plans to further implement, the push for more inclusion, more diversity that President Hargis did, with the list of urgencies, with some of the black students who were trying to push that. What are your plans, for diversity on this campus?
Right. Well, that's an important, issue for me, for my family. I have a diverse family. And so, really as a mother of 6 children, 2 of whom are female and 4 of which are males, 3 are African American. I really, think it's important not only for people to feel welcome, but to feel valued. I think that's what we want for everyone, for anyone who's at Oklahoma State University, to feel valued as an individual, and for this to be a place that they can, grow both personally and professionally, and feel like they're giving. And so that's really something that is important to me. I know that President Hargis has a task force, and that report's going to be coming out soon. And I think just as important as me getting to know all the academic leaders, I want to meet with students and understand from their perspective of what they feel like we could do better, or we are doing well. And use that as a way to kind of understand before drawing any conclusions. So I know the task force is coming out with their recommendations, but just to have the opportunity to hear from different individuals and get their opinions and listen, and then kind of formulate what we're going to do as we go forward. And I know that's it is a really important issue. It's important to society. It's important to the state. And as I said, important to me personally, as I have a diverse family. So it's something that will be an important piece of what we do going forward.
So students should not feel ever uncomfortable with reaching out to President Kayse Shrum?
No. I mean, I actually look forward to meeting some of the students. And, I've, at the Center for Health Sciences, had, an open door with students. Obviously, sometimes you get busy and it takes a little bit, but I always welcome the opportunity to visit with students. And you really just to get to know them. I really think, some of the most meaningful conversations can happen when you have a trusting relationship with someone. So I think that's, why it'll be important to develop relationships over a period of time, to be able to have those difficult conversations. And I say, we've done that within our family. And, sometimes it can be uncomfortable because, you want to, people, you want to make sure you're saying the right thing. But I think the most important thing is being in a place where people feel like they're being heard and listened to, and that they can, talk freely and really learn to understand one another. And sometimes, that happens over a period of time when you've developed a relationship with people that they feel open, and comfortable in talking to you, and know that their voice is valued, and you're really trying to understand from their viewpoint and perspective.
So true. Yeah. And I know that before students come into a meeting with Kayse Shrum, is there something that you think every student on this campus should know about you that they might not already know?
Oh, I think probably, because every student I won't have the opportunity to interact with, but, I really do enjoy, meeting with students and visiting with them. And I think sometimes, having a title of president or doctor, that can be somewhat intimidating. But, I have the opportunity, like I said, to meet with my kids and their friends all the time. And I think they'll find me to be very, down to earth and welcoming, and, not intimidating at all. And so would want them to feel comfortable, coming and visiting with me. Because I really do care and want to make sure that they have a good experience.
Yeah, and I know that, sometimes, maybe in previous years, I know that President Hargis didn't really do it as much as he would have liked to this year. Him and Ann would just either be walking across campus, or Ann told me that she would drive that, I forget the...
Clementine.
She would drive Clementine around campus.
Yes.
First of all, are you excited to drive Clementine?
Oh, yes. Yes. Yeah. Well, I am looking forward to that and being able to kind of, go around campus as well. And, before, the other thing that we're kind of excited to get involved in is Pete's Pet Posse. So when at the Center for Health Sciences had a dog that was in one of the very first classes there. Nice. And we have a new dog. His name's Goose. He's a crazy little lab, and so we're looking forward to getting him in the program and being involved. My husband being involved with Pete's Pet Posse. So that was always something that we enjoyed. Having our dog involved in the past. So looking forward to that. And like you said, just kind of being out and about on campus and getting to know students. And we really enjoy, sporting events and just, other events on campus. So probably see us at a lot of those events, just, being able to get out and see everyone.
Threw out a pretty good first pitch.
Yeah.
How'd that feel?
Yeah. Well, that was fun. And so I've been to the softball game. I've been to the baseball game. I've been to the tennis match. And so we're enjoying all of those opportunities to get out and kind of see what student athletes are doing and meeting students. And so that was the Bedlam match, which that was great. We won. And that was really fun. So.
Tell me about Dr. Kayse Shrum, the sports fanatic, because if you're going to all these tennis matches and everything, it sounds like you're going to. Are you excited for what will be, I guess, ceremoniously the 100th, technically 101st now, homecoming this year?
Yes. Yeah, that's exciting. Yeah, I actually, we love, sports. I played softball. Yeah. My husband played football. Really, any athletic events we enjoy going to. And of course, homecoming this year, that's going to be a lot of fun. I know everyone missed that last year, and so we're looking forward to that this year and celebrating and being a part of that this time around. So, we've always come up and participated and gone through walk around. And one year, our son and our daughter's fraternity sorority were paired, and that was kind of fun.
Oh, that's awesome.
So we got to do that, and that was our son's last year, so that was really neat. So we have a lot of great memories of homecoming, and we're really looking forward to this chapter of homecoming memories for us.
Right, and I know one of your kids, I believe it's your son, does not go here. One of your sons does not go here? He
plays soccer in Arkansas. He's on a scholarship. He's the only one, and so yes, yesterday Darren was in Arkansas and watched him play soccer, and then drove here to be here for the Women for OSU reception. And so, that night, the Friday night of the announcement, the kids had him on FaceTime, so they were waiting, and then, of course, it kind of rolled into the evening, and he got off, FaceTime, and he called them later, and he was like, "You just forgot to tell me," and they're like, "It hasn't been announced yet." So anyway, but we miss Kaysen, but he is enjoying his freshman year, and so if there was men's soccer, we'd have him here. But
I guess that makes sense.
Yes.
Let's go back to that Friday night. That was wild. I just know that from my perspective. Oh my goodness, just the waiting of it. Have you ever gotten any indication of what took so long at all?
No, I think that, obviously, Burns and Ann are big shoes to fill, and it's an important decision, and I think the regents wanted to make sure that they were making the best choice, and that, they were all, being heard, and they were talking through those, decisions. And so, no, I haven't really. But I think that, a decision like that probably, does take time. So
requires a lot of attention.
Yes.
First time since 2007 that it's had to be made, so it makes sense.
Yes.
What was that night besides the FaceTime aspect? What was that night like for you? Just waiting hours on end. I was nervous who the president was going to be. I'm sure you were
Yeah.
What were you thinking?
Well, I was very calm.
Okay.
Some other people around me my husband was nervous, and he kept watching but, I really did feel like, the regents would make the right decision. And, you and I talked, probably very early on after President Hargis had announced. And I said, I'm willing to serve in whatever capacity is right within the system for me and how the regents want me to do that. And I really felt that way. Of course I would have been disappointed. I'm human. I would have been disappointed. But I also feel like I had a wonderful job where I am, and I love Oklahoma State University. And so I just try to kind of stay in that place of, I want to serve. And if it's as the president of the system, I'm, going to be excited. And if it's, continuing in the role I'm in, I'm going to be excited about that too. Hard place to kind of stay. I think that was just kind of the way that I tried to think about it. And we really just, Darren and I sat there and just kind of talked, and we didn't even really watch TV. And then it kind of, started getting a little later, and I thought, maybe I should put my sweats on and get comfortable or something. I was trying not to, wrinkle my suit. And so just about the time I did, I took my suit off and I put my sweats on. I thought, I'm going to get comfortable. My phone rang. And so I, answered, and they said, can you, come up to the Office of Legal Counsel? And I said, with a suit on, or so I had to change and head up there. But yeah, so it was, it's one of those nights that, if it went really quick, it wouldn't be quite as memorable, right? So now everybody has the memory of eating pizza and waiting, and it makes for a better story.
I loved it. I think it was one of the best nights. It was really just interesting to see that kind of happen. These Board of Regents meetings, you're gonna have to deal with a lot of those.
Yes, yes, sure absolutely. Yeah.
Are you? I guess. It's interesting from a medical school versus Center for Health Sciences versus a university. Have you sort of done more research lately, or found yourself doing more research lately about just academia all across the board? Or do you think you're just going to take the same approach that you did at the medical school?
Well, I do think it's, there's a little bit, of a difference. Not, maybe not necessarily in the, academic side of things. Everybody's, promotion and tenure rules are slightly different, or the research incentives, or, the details of those things. I think, obviously the admissions process is, different. The landscape of, what you're looking at it is slightly different. From the graduate program perspective, I think that pretty much translates. But yeah, I started, reading, a little more of the higher education journals and stuff like that, as opposed to academic medicine journals. But, there are, like I said, there are some things that translate, and then there are some things that are slightly different. But, the great thing is, I said this in one of my interviews, I really believe leadership is portable, and building strong teams is important. And there are, for every, area of the university, you have a leadership team that's there to advise you. Right. And so I think there's a really strong leadership team and people in place that are doing great things that will be helpful in the transition. But yes, it kind of did change my reading a little bit over the last year or so. But
something that can translate is your experience as a health leader in the state, guiding a university, a state university, through a public health crisis, which is still going on, as obviously you know. Right. What do you anticipate the fall looking like? Sort of in a time where it seems like it may be the end of COVID, maybe around that time, knock on wood, hopefully. What do you think the fall will look like?
Yeah. Well, I think we still have to, be somewhat cautious, right? Yeah. And as people have the opportunity to get vaccinated, that changes things. Continuing to monitor cases. And I think being, more cautious going into the fall is going to be important, because what you don't want to do is, kind of throw caution to the wind and have a spike or something along those lines. And I'm kind of watching, what's happening across the United States and different states that have, what their caseloads are doing right now. In Oklahoma, our hospitalization numbers are pretty low, but sometimes we see a little, creeping up of the number of cases, which, I don't think we're probably ever going to be at zero cases, right? Because, here we are, and it's going to be a part of, what we deal with all the time. I mean, we're already talking about, vaccine boosters and those kind of things. So, but, I do think it's something that, we just have to be very thoughtful on. I know that everybody wants to get, back to in-person classes. And so, I think we'll just kind of, go cautiously into the fall and, see how things continue to go over the summer. I think is going to be an important time frame to really know. So I think kind of projecting from here out to the fall could be, somewhat misleading. We just have to see what it looks like as it gets closer and kind of monitoring all the data and making, the best decisions based on data.
So true, and that's what you've been doing all this time.
Yes,
it looks like,
yes, it is. It is that, that's pretty much what we, had to do during the pandemic, and so we'll just continue to do that and make sure that, we're cautious so that keep everyone safe, and being able to be here on campus having classes is the goal.
And something, I know in my own state, the top 2 state universities, public state universities, Rutgers and Montclair State, they both recently announced that they're going to require vaccines. I know at least 40 schools have done it so far. Do you think OSU will do that?
I would say that it's, probably not likely, just based on, some of the conversations that I'm hearing and, some of the, other discussions that have been going on. Mandating vaccines is not something that anybody's brought to me from a policy perspective to consider at this point.
But a lot of Oklahomans can get vaccines right now.
Yes, we are definitely. I mean, that is one thing that we're really trying to do is make vaccines available to anyone who wants one. And of course, the more people we have vaccinated, the easier it is to get back to normal. And so I would encourage everybody to get a vaccine, or at least talk to your healthcare professional about whether or not they think it's right for you.
I got mine with a smile on my face.
Yes, yes.
I loved it.
Yes, I was in line very early getting mine because as a healthcare provider I was able to get that early. So and I would encourage everybody to do that.
Right, and if vaccines are not required, right? This is still thinking ahead to the fall semester. What are your thoughts on what the mask situation will look like? Maybe in classrooms, or just around campus? Yeah.
Well, I think that's something that we're going to have to, really look at. What are the cases and what's going on? And we look across the state. There are, mask mandates that are expiring and those kind of things. It's hard to know what will look like in the fall to be able to say we aren't going to have masks. I think at this point we should just kind of monitor it and decide as it gets closer. As a precaution, obviously, masks are the safest thing to do. And of course, that's what we're doing right now. So we'll just keep our eye on, kind of what's going on across the state, again, with, what our numbers look like and kind of what the CDC is saying. And I mean, sometimes those guidelines change, and that changes what we can, what we use to make those decisions. So.
Something that you have been so involved with is Native Americans in Oklahoma, and especially dealing with healthcare wise. There's been so many reports lately that Native Americans in this state have done a tremendous job in further progressing the vaccines of this state, right? And sort of that's the reason we're in phase 4 right now. I mean, heck, I know Biden recently announced that all adults will be able to get the vaccine, but I know that this was Oklahoma back in, I got my vaccine in February. I mean, this is wild.
Yes.
What are your thoughts on the way they've been able to help?
Yeah, it's been great. Part of that is the state gets their vaccine supply through, one avenue, and the tribes get their supply through another avenue. And so having, the supply of vaccines coming into the state, and then, the tribes being willing to open that up to non-tribal members. And really in, rural areas, our tribal health facilities, have a big presence. I mean, they're some of the most sophisticated healthcare delivery systems in rural Oklahoma. So having them to partner and really being able to, roll out more vaccines has been tremendously helpful. I think that's really what helped us kind of move forward, as you said, in the phases, but also to, for people to just get access to it. Because we haven't really been limited on, what supply we're getting. That's been, coming, and we've been able to roll that out. Of course, I know in the beginning it was really hard for people to get an appointment, but as, more people got it and we opened up more and more, and people got, more sophisticated in the way we were, vaccinating and doing our vaccine clinics and those kind of things, it's really opened up to where people can, get a vaccine if they want one.
Right.
Yeah.
And that's the thing that I've noticed is that I was, throughout this whole pandemic, I was just waiting for sort of just one solid headline or notification on my phone that said, oh, vaccines, the vaccine's ready, or something like that, right? But what I noticed is that it was a progressive thing. It progressively happened, whether it was Oklahoma moving into phase 2, then Oklahoma moving into phase 3. I checked my phone, oh my gosh, phase 4. And I'm just a guy. I'm just a student. Yeah. You're somebody that oversaw a majority of the, health crisis, a lot of the health crisis in this state. What was that like for you to see these phases roll so quickly?
Yeah, I was very pleased. That was part of when I stepped off of the, task force. You know you're leaving it in good hands, and you're hoping, that things continue to progress, and kind of see that happen. And to have the vaccine coming in and to see, that rolled out so smoothly was very, rewarding to see that happen, and very pleased. I had a lot of my family members got vaccinated, and, we were able to all get together on Easter.
Nice.
And that was really, really nice experience. And so, it's been good to see for the state. It's also, I think, been great for, my family, and being able to see, my grandmother and my mother and dad and those kind of things, and get our families together. It's been great.
That is awesome to hear.
Yeah.
And I know that, this summer is going to be interesting too, because you're going to, like you said, that's probably a very crucial part about this health crisis this summer, to see where the cases are at, and for you, for a policy perspective too, just planning that from there,
Yeah, and just see how, we continue to vaccinate and watch the cases, and then, as it's fall and time for students to come back, kind of see where we're at and kind of make those decisions based on what it looks like at that moment. And, I think that's been the thing about the pandemic that, maybe we're all getting a little more used to, is realizing we can't project out into the future, and, what decisions we might make today may not be, the most up-to-date information 3 months from now.
Right.
And, so we've all kind of learned that this really is, we're all kind of learning about it as we go, and we're making the best decision we can at the moment with the information we have, but maybe better information 3 months from now. So we'll just kind of keep monitoring all that to make sure that we're making the best decisions.
We will see what it looks like. And I know recently, this is switching gears completely, but going back to your presidency, I know recently some things, or I asked you at one of the press conferences, what if Burns Hargis had explained some of the perks to you about the job, and I know, the contract is almost finalizing, or it's soon to be finalized. What has that process been like for you? And I know the salary is in at $650,000. What is it like to see that number and see some of the more things in your contract?
Yeah, well, I as we kind of, that evening we had a conversation and really came to agreement on the terms of the contract. The contract has to be written and finalized and signed. But I was, very pleased with how that turned out. And, you were kind of talking about what were the perks that President Hargis said that he liked. I think he said, what he was surprised, one of the things he was surprised about was, how the OSU connections that are international that allowed him to travel and meet people that he never would have met. But he said parking is definitely a perk.
Park anywhere. I bet you can park anywhere.
Yeah, yes. I think that, that will probably be a big perk to being on campus. But, I think there are a lot, obviously just, as throughout the years, I've heard President Hargis and Ann talk about, if there's ever an opportunity to be a university president, you should pursue that because it is, a job of a lifetime. And so I think there are probably so many, perks to it that aren't like, the things that you would think of, but just the memories and the things that you get to do that are, meaningful and transformative and the lives that you get to touch.
Yeah.
I mean, for me, moving from the medical school to here, it's kind of, there's more students and there's more of an opportunity to make a difference. And, that's the most meaningful, the most important thing for me.
Right. And on that note, you haven't even started your first day yet.
Yeah,
you are still weeks and weeks and weeks out.
Yes.
But you are, in recent memory, you're one of the youngest OSU presidents.
Yes.
Okay. In fact, you might even be the youngest. I didn't do that much research into the OSU presidency history going back to the 1800s.
Yeah.
But do you know what's next for you after this?
I don't. I'm just looking forward to, this new experience and, learning and, I mean, sincerely hope that, when my tenure's through here at OSU, that I've, left a legacy, close to what President Hargis has left, and that, it's much better place because I sat in this seat than it was before. So, but beyond that, I haven't, quite thought about that, but, I kind of have always taken whatever opportunity I have and really focused on that and tried to do the best that I can do in that role and, make a difference there. And, who knows what, happens in the future.
There's really not much else you can go up from, from here. I mean, at least in the OSU ranks.
Yeah.
I would think, gosh, let's just think out loud. Let's brainstorm a little bit, okay? I think maybe governor, that could be a possibility.
Yeah. Well, I don't, I had the opportunity to kind of serve as a cabinet member. So, I don't know if governor would be something that I would, want to do. Certainly it is a demanding job and I got a front seat view of that, but yeah, I mean, I don't, I don't know. I think it would, whatever I would do in the future, if it's beyond Oklahoma State University, again, I think it would, have to be something that I felt led to do, that I felt like I could make a difference in that at that particular time, in history or, I mean, was really, serving on the task force. That was part of that for me was, I would have never imagined doing that. So, but it was, that sacrifice, it was really because I felt like, man, this is an opportunity to, serve Oklahomans and do something meaningful. It's hard, but it's that opportunity. So those are the kind of things that I think just present themselves to you that you can't even imagine. And that's what I always try to tell, students. Even, my first time on this campus, I was 13 or 14 years old, and I was attending a softball camp, and I was staying in the Atherton. And we were just, I mean, it was dark, and I heard like a lot of hammering, and so my friend and I, we were looking out the door, and you could see all the fraternity houses,
right.
And we thought they were building forts in their front yard, and it was around homecoming, and so they were working on different things and decks, and I go back to like that moment in time. If you would have asked me that day, Kayse, are you going to be the first female president of Oklahoma State University? The answer, I mean, I would have never dreamed it.
Yeah.
So I always try to tell, students, and you're asking me what I think I could do. I mean, I think you should just keep your mind open to any possibilities. And if something comes along, even if you feel like it's out of your grasp, go for it. You're going to get a lot further. Even if you don't quite reach that goal, you're going to grow in the process, and it's going to take you further down the road than you ever thought you would be.
There you go. And you are focused on the task at hand.
Yes.
You got a big opportunity headed up for you. But Dr. Shrum, we appreciate you joining us right now.
Yeah.
President designee, I
Yes.
cannot say that yet. Shrum,
Yes.
hopefully we just drop the designee soon,
Yes.
July 1st. Thank you so much for joining us today. We appreciate having you on the program.
Thank you for having me.
Absolutely, anytime.